Hi, everybody. Good afternoon. Thanks for joining us. My name's Emily Cooper. I work on issues related to housing and homelessness at MassHealth, which is the state Medicaid agency. And I appreciate you spending this next hour with us to learn a little bit about MassHealth and how you can help people on MassHealth, who we call members, with their renewals. We're going to go through some information and then have some time for questions at the end. If you have questions as we go, you can put them in the chat and we will get to them during that section. If you have technical issues or anything related to the Zoom function itself, please go ahead and put that in the chat as well. And we have lots and lots of people behind the scenes who will be answering those and trying to problem solve. So I'm going to go ahead and get started here. If you could move to the next slide, please. So first, let me say that we're recording this. And I know somebody's going to say, where is the PowerPoint? How do I get a copy? So we are going to be posting this online. It'll take a little bit of time after we finish today, but don't worry about scribbling madly because this information will all be publicly available. So today we're going to talk about what is a MassHealth renewal, why it's important, particularly now, what you might be able to do to help somebody who's on MassHealth in preparing for how to complete their renewals. And this particular call is specific to organizations who are working with people who might be experiencing homelessness. They might be part of a homeless family or an individual experiencing homelessness. So we're going to flag some things as we go through that might be unique or some special considerations for those individuals and families. Next slide, please. So the information we're presenting today is for you all who we assume are working in the community and interacting with people who are enrolled in MassHealth, which again, we call MassHealth members. We're trying to give you some helpful tips. We're not expecting you to be experts in MassHealth. This may be your first foray to even being on a MassHealth webinar. This is going to cover basic assistance. We're going to give you, what are the important deadlines? How do you what's going to happen? How is this going to work? And then also places to send people who need more assistance. Keep in mind that information about your healthcare, as it is for you, MassHealth information is private information. And, you should not be accessing that information without the proper authorities in place. So this private health information is protected like your health information is, and you shouldn't be distributing that internally or externally unless the member themselves give you authorization to do so. The right to access or update MassHealth's member information is also reserved officially for certain MassHealth employees, people who've been designated by the member as their representative, or things that we're going to talk about later called CACs, Certified Assistance Counselors and Navigators. However, let's just say you're not any of those things. You can still be helpful, and that's what we're going to talk about today, how you can have an impact on making sure that people on MassHealth keep continuing to get that MassHealth services, which include, as you know, things like really necessary healthcare, but many of you also provide services to individuals and families experiencing homelessness, such as the Community Support Program for chronically homeless individuals, sometimes referred to as CSPEC, CSP, ECH. So you should know that that is MassHealth funded. And if we would like people to continue to receive those services, they need to continue to be on MassHealth. Next slide, please. So what is a MassHealth renewal? So in general, the federal government requires everybody on Medicaid, that's what MassHealth is here in Massachusetts, to basically renew or to be checked every year to make sure they're still eligible for MassHealth. This check is called a renewal, sometimes called an annual renewal. Those of you who work in the housing industry know it's something similar that we do in housing, where we check every year to recertify that the person is still eligible. Very similar, but this time it's MassHealth. So they need to occur every year. And the renewal process takes place by mail. Renewal information is sent by mail at the household level, sent to the head of household that we have on file here at MassHealth. We're going to talk a little bit about that. So don't worry, I know you have lots of questions. Mail, how's that going to work? Head of household. And some members may be automatically renewed. This means we're going to, behind the scenes, be doing what we can to match information so that you don't have to, so the person doesn't have to do any additional paperwork. But in those cases where we can't do that matching automatically, we will reach out via mail to a member and say, hey, we need some more information. And they will get a big blue envelope. And if you don't get that big blue envelope, if you get that big blue envelope and you do nothing, then you may lose your MassHealth coverage. So that is big. That is a lot of information there, and it's a little scary. So we're going to dive in a little bit deeper here so we can demystify it a bit. Next slide, please. Why are we suddenly talking about this? People have been on MassHealth, Medicaid for years. We've never had this webinar like this before. You've never heard about a big blue envelope. So why is this an issue now? So as with everything, the pandemic changed it all. So at the beginning of the pandemic, the federal government said, there's a public health emergency, so you do not have to do that annual renewal. In fact, people on Medicaid, on MassHealth, can have continuous coverage. So people have been on MassHealth, their coverage didn't end since February of 2020. On April 1st, 2023, just a few days from now, all states in the nation have been told that they need to start the process again for people to renew their MassHealth coverage. So we're going to return to our standard annual eligibility renewal process. Sometimes you may hear this called redetermination. So starting April 1st, all members who are on MassHealth will be renewed and we'll be checking to make sure they still qualify for MassHealth. It's not going to all happen on April 1. That would be a very cruel April Fool's joke. It happens actually over a whole period of a year, from April 2023 to 2024, so 12 months. And a person could get mailing and renewal forms anytime within that year. Again, if you think about it like housing, which I know some of you are in housing world, people's leases get renewed at different times of the year. They get recertified by housing agencies at different times of the year. Their anniversary date is different dates. Same thing with MassHealth. So this will flow out at different times of the year. Next slide, please. I want folks, if everything I've said right now has sounded to you like Charlie Brown's parents, I really want you to perk up and listen to this side because I think it's really important. So as I mentioned, we're doing what we can do behind the scenes to make sure that people are automatically renewed. And there's a whole group of people, we call them referred eligible members, but there's a whole group of people who get Medicaid, who get MassHealth because they applied for something else. So they applied and got SSI because they're 65 and older, for example, or they applied and got SSI because they're disabled and have, limited income, or they got TANF, temporary assistance for needy families through DTA, or they're getting EAEDC, which is the Emergency Aid to Elderly, Disabled, and Children's Program through DTA, or they are members, are in custody with DCF, Department of Children and Families, or Department of Youth Services. All of those folks got their MassHealth kind of through a different door. And as a result, they may not have to do a lot of this paperwork. They will most likely not get a blue envelope and their coverage will be all set because it goes through this different door. It is possible in a few instances they might get a blue envelope or even a white envelope just saying, hey, we need a little something, and they should respond. But in general, people who have gotten MassHealth through these other doorways will most likely not get an envelope and not have to go through this process. So I just want to flag that, because I know, as you know, that many people that you're working with who are experiencing homelessness receive these services, receive these benefits like SSI, like EAEDC, like TANF, and they got their MassHealth through that doorway. And so I don't want you to say, oh my gosh, they never got their big blue envelope. It may be that they are all set and they're just being taken care of through a different pathway. So the next slide, please, is we're going to start talking about how you can help. So there's really two ways. One, help them prepare to say, hey, this is coming and what do we need to do? Because as I said, it's going to take a year. And so they might not get their big blue envelope till October. And so what can you do between now and then? And once they get their information, what do they do with it? And that could be you're sitting next to them and reading it to them and doing instructions on the form, or that could be, hey, we're going to call up this MassHealth eligibility person and say, we need some help. Next slide, please. So the first thing kind of in the middle of this slide is posting information. Many of you work in shelters, in day programs, in places where people experiencing homelessness go, congregate, are. And if you can post flyers and you can kind of get out there this mantra of check, like pay attention to this. This is something that's important. We really feel it, we don't want you to lose your health insurance. And maybe even saying to them, your health insurance is, if it's MassHealth, maybe paying for some of the assistance that you're providing. So for example, back to that conversation about the community support program for persons experiencing chronic homelessness, that's a MassHealth funded service. You're providing housing search to people. If they're not on MassHealth, if they lose that coverage, you're going to need you may not be able to help them as much anymore. So there are flyers, there are toolkits. There's a website here, and I'm going to give you lots of websites in a few minutes, but get the word out. This is important. Pay attention. This is why it's important. Remind people to update their information. So this is tough, right? So you have people experiencing homelessness, and one of the things we're going to do is by mail. So, if they have a steady mailing address, meaning somebody who they know that they can get their mail on their behalf, or a place. So for example, St. Francis House in Boston, I know serves as a mail post office of a mail place for many people experiencing homelessness. Make sure that people have, if they can, have told MassHealth, this is a good place to send this mail. They can even provide a phone number. They can provide an email. If anything has changed, they've had a new child, they lost their job, they got a job. All of those things are going to be things that MassHealth needs to know. It's been a while since 2020, and that's the last address we have on file for them. If they were housed, for example, at that address, and it was their parents, for example, then the envelope's going to go there. If they happen to know where that is, then, that's something that, maybe talking to the parents and saying, hey, keep an eye out for this. We're going to talk about more specific things we can do that we're going to have planned for people experiencing homelessness. But we also want you to just encourage people who may not be as interested in their healthcare right now, because they've got other thoughts going on, to take action in this area, to do what they can to keep this coverage. And I'll tell you all the ways you can do that. Next slide, please. So first of all, the easiest way to update a MassHealth's members' information is to go online. And you can go to this account, the MA login account that we have on the screen, and establish an account. And in there, you will see, oh, this is the address we have for people, and you can update that information. If you don't have an account, if the person you're working with doesn't have an account, then there'll be a link in the big blue envelope, or you can call the MassHealth phone number you see on the screen. You can also just call MassHealth customer service, which is, I'm going to say this number because I think it's important for people to know. It's 1-800-841-8888. 2900. You'll be able to tell by talking to them through the system whether you owe documents to MassHealth. You can also get help from, as I mentioned, a certified application counselor or a navigator or other places, and we have a list there. It's important to note that the head of household that we have in MassHealth can update information for the entire household. So you don't have to do all separate things. You can do it all as one head of household. And the head of household is who all the mail is being sent to. And if that has changed, then you can log on or you can use the customer service number and tell MassHealth how your situation has changed. Now I'm making this all sound really easy, I know. So, and I know I know I can't see you on screen, but I know some people are rolling their eyes at me. So don't worry, I will be telling you more. And hopefully you'll stop rolling the eyes, let's say. So the next slide, please, this is the big blue envelope. So look for it. It doesn't say MassHealth on it, but it sure looks official, right? There are other envelopes people might get that are also from MassHealth or the Commonwealth of Massachusetts that aren't blue, that should still be opened in a timely manner if they receive them, because there might be other things like, hey, we sent you something and we automatically renewed you. You don't have to do anything. Or it could be, we need a little bit more information, and those might arrive in a white envelope. So that's something to be aware of. Next slide, please. Once they get something from MassHealth, we could really use your help in helping them read it. So that may be that if somebody doesn't read, that's something you can read it to them. There are lots of services in the appendix of this that we could talk about translation services, or if you can translate, thinking with them. There's time frames in this, so we'll talk to you about that, making sure that they're aware of the deadline, walking through the instructions on the information, working with them to say, okay, how are we going to get this information back? Are you going to do it online? Are you going to make a call? You can send it by mail, but talking to them about what needs to be done and making a plan with them. If they have questions, or frankly, if that's not something that you have the ability or time or capacity or just, you don't feel comfortable with, you can connect them with lots of resources that we have at MassHealth to help them through this process. So let's go to the next slide. And actually, sorry, go back for a second. I just want to flag that there are 2 documents also, and there's I'll show them in the appendix later. One is the permission to share information, and one called the PSI, and another one is called the Authorized Representative Designation, or ARD. Both of these are MassHealth forms that give the member gives you the authority to know things about them, and in some cases make decisions with them or about them. So if this is something where you envision that your agency is going to be working very closely with somebody and would like to be very involved in this, you can have them sign a release so that you can be doing this with them, or depending on the type of release, on their behalf. So there is that opportunity as well. Okay, next slide. So again, how do they complete their renewal? Well, the easiest way is to go online, but the folks may not have access to computers or tablets or phones. You can mail the renewal back. You can call the customer service center, or you can book an appointment with a MassHealth representative and sit down with them, and they will help you with it. Once you get an envelope, you have 45 calendar days, not business days, but calendar days, to fill it out and send it back to MassHealth. And in many cases, particularly for people under 65, it may be a pre-populated document that you just need to check and figure out if anything's changed and sign. So it may be pretty easy if things have not changed in your life since February 2020 with regards to income or other things that might determine whether you're eligible for MassHealth. Let's talk a little bit more about how you can get help. Next slide, please. So as I mentioned, there are MassHealth enrollment centers. These are colloquially known as MECs, and they can provide help over the phone. They can do it virtually. They can do in-person assistance. There are 6 MECs across the state. And we encourage you to schedule an appointment ahead of time. And again, appointments can be made via the phone or virtually. And you know, trust me, they will be busy. So you want to make sure to set up your appointment and not just sort of walk in and ask for help. There are also another avenue are certified application counselors or navigators, so CACs and NAVs. And these are individuals in the community who are working at other agencies that have gone through special training to help people with their MassHealth applications. They are not MassHealth staff, however. MECs are MassHealth staff, CACs and NAVs. Wow, that sounds like a mouthful, right? Are volunteers in the community who have been trained to help people with their MassHealth coverage. They can help people keep their coverage. They can help people apply for coverage. It is free, the assistance, but you do require an appointment, and you can go online to find the nearest organization. So many agencies, many healthcare agencies, some correctional facilities, educational facilities, you'd be surprised what types of organizations actually have CACs. And we're going to spend some time later telling you, if you want to become a CAC, how to do that. And then there is the MassHealth Customer Service Center. If you know they have questions, you can call them at the MassHealth Customer Service number. As I said, it's 800-841-2900. It's open the business hours of Monday through Friday, 8 to 5. And what's really nice and important I want to call out here is you can get assistance in a variety of languages through the customer service center call line. And if we don't have a person right then who can do this, you can request a translator for any other language that the person might speak. Next slide, please. So this is kind of the overview of the timelines of how the process works. So somebody is selected for renewal, and we try to do it automatically behind the scenes. So that will happen, and wherever possible, we will do that. And you won't even, you might get a white envelope saying, we've already taken care of this, don't worry. If we can't do that, we will send the big blue envelope in the mail with a renewal form that you need to complete and return to MassHealth within 45 calendar days. If you send that in within 45 days, but it doesn't have everything MassHealth needs, they may send you a request for information, and then you'll have an additional 90 days to respond. If for some reason they say, you know what, we've taken a look at your coverage and it doesn't look like you're eligible anymore, they will send you a termination notice. And typically you have at least 14 days after receiving the notice before the benefits stop. If you are saying, wait, I shouldn't have been terminated, I want to talk to somebody about that, we're going to reconsider it, people can be reinstated as long as they're contacting MassHealth within 90 days of their coverage terminating. So I know, again, there's a lot of information here. We're going to post all of it, so you don't have to remember each one of these deadlines, but it's something to be aware of, that there are timelines. Next slide, please. So I want to just flag that some letters have already gone out, and it's not even April 1st. So you may be working with somebody who got this sort of mysterious letter, and it says on the right here, MassHealth has received information from a trusted source that your contact information has changed. Please update this information as soon as possible, and here's how. And I know a lot of people were like, is this real? Is this, Publishers Clearinghouse? What's the story with this? So I want to say, yes, it is real. And what we did was, again, behind the scenes, we've been trying to confirm people's addresses with trusted sources like the Postal Service and credit bureaus and things like that. So if we got information and we wanted to somehow change your address because, gosh, over here, the Postal Service has it this way, but we have it this way, we wanted to make sure that was okay with you. So we sent something to both of the addresses and said, please let us know that this is okay. So if you got a letter like this, you should contact MassHealth and make sure that they have the accurate information on file. So I want to make sure that we flagged. It wasn't in a big blue envelope, but some people have said they've been receiving this. Next slide, please. Let's say the person goes through the whole renewal process, the whole redetermination process, is no longer eligible for MassHealth. We want to make sure they can still get health insurance coverage. So here in Massachusetts, for people who are under 65, we do have options available through the MassHealth connector. And there's a website where you can enroll and learn more about the MassHealth connector. Of note, many people who are familiar with health insurance, you usually can only enroll at certain times of the year. Well, losing MassHealth coverage is known as what's called a qualifying life event. So that means you can enroll in the Health Connector. You don't have to wait for an open enrollment period or a certain time of year. For people who are over 65, there are a variety of options. If you don't qualify for Medicare, you may still be eligible for the Health Connector. If you lost MassHealth because you lost SSI, you may be able to reapply for MassHealth. If you're not eligible for MassHealth, you may qualify for a Medicare Savings Program, an MSP, or there are other programs like PACE that some are familiar with, and other programs run through local older adult agencies that may be able to provide health insurance. So next slide, please. All of this information, which is a lot of it, is covered in the MassHealth Renewal Help Guide, which is coming soon and is all available on the website. Oh gosh, this was a lead in. The website, which is in 2 slides. Can you go 2 slides for me? Perfect. The website. Okay, everything I'm saying, everything I'm talking about, the recording of this, the PowerPoint for this, all on this website, mass.gov/MassHealthRenew. Okay, so again, if you take away nothing from today, if you're like, oh, this was a waste of my time, or I don't know what's going on, and what's this with the envelopes, and this doesn't work, people are homeless, mass.gov/MassHealthRenew is the place to go. Can you go back a slide for me? Thanks. So there are other ways you can help. If you really this is something that's really important to us, we want to know everything about it. There is a MassHealth eligibility redeterminations email list. So you'll get updates, it's a listserv, and the website is there. You can join the Massachusetts Healthcare Training Forum, also known as MTF, which sends out emails and has lots of trainings. Again, if you're interested in healthcare and related Medicaid things, it is lots of helpful information. And then I mentioned earlier the CACs, the Certified Application Counselors, and agencies and community-based organizations are welcome to become certified application counselors and be able to help people apply for health insurance benefits, enroll in health plans, and maintain their coverage. The way it works is it's voluntary. So no one pays for the help they receive from CAC, and CACs are volunteers. CACs become trained and learn how to help an individual. A CAC is an individual person, but in order to become a CAC, the agency you work for has to enter into agreement with MassHealth and then designate who within that agency would become trained to be a CAC. So it is the trainer is the individual, but the CAC is an agreement that the agency says, yes, this is something we want to do. And if you are interested in the CAC program, we have an email address there. There was a webinar Monday, one of those days earlier this week on how to become a CAC, and that will be posted on the website we mentioned, which is on the next slide, mass.gov/MassHealth Renewal. Okay, so you've been waiting with me. I've been talking at you now for a half hour. How does this, what are we doing about people experiencing homelessness? So next slide, please. I know, that mail is not the best way to get information to people experiencing homelessness. So it's highly possible that they will not get a blue envelope, a white envelope, or any envelope. And so MassHealth is working with DHCD to identify MassHealth CACs or MECs or other staff that we would have visiting the shelters for shelters for individuals that DHCD funds. And so what we're asking is that these shelters and day programs help host these workers that we will be sending out. It may mean giving them a private space to have a conversation. It may mean helping with some IT. Mostly what it means is encouraging people that you work with to go sit with them. So if Toby shows up and he is the CAC who is going to be helping that day, and he has arranged with your agency to be there on the first Monday of every month, that you're telling people ahead of time, hey, Toby's coming tomorrow, stop by and talk to Toby. And Toby's going to be able to, if I sit down with Toby, Toby's going to be able to look up my record in MassHealth, whether I got a blue envelope, a white envelope, or no envelope at all, and say, hey, let me do what I can to help you with your renewal, even if it's not my time of year. Remember I said that it's going to happen over a year? We're going to be doing this so that it doesn't, we don't have, when we get that, when that person shows up and talks to Toby, we're going to make sure that Toby can do everything for their MassHealth application that they can. We will be we're working, as I mentioned, with the Department of Housing and Community Development to set up a process for this. And you will be hearing more as we work to set up this outreach and work with your agencies and programs about this. So again, this is for the individual shelters. For the family shelters, the EA shelters, we have been working in we have an data sharing. So we're getting up-to-date addresses of everybody in EA shelter. And so they will be getting blue envelopes if they're eligible for one, or white envelopes if they're eligible for one. And we're hoping that you all can make sure they get them there. If for some reason they have moved out and are now in receiving home base, that you are communicating with them that they got a blue envelope and connecting them with someone who can help them complete it. Okay, I am going to, I think, I just want to actually go, I think we're going to, I just want to flag that in the appendix, if people need them, we definitely have lots of resources to help people who have language issues or speak a different language or need translation services. We also have lots of information about how to assist people with disabilities, and also what this renewal means for a person if they have a disability, and what they might need to do. But I think I'm going to stop and take some questions. But I know there's been a whole bunch behind the scenes that I haven't looked at. So I think if we can take down the slides.